So I likewise have had negative experiences with the healthcare system. I had breast cancer twice in my 30s, and really ended up at in the end of things. I remember the process with the hospital was for them to send me to their finance department, and their process was to call my bank and get me a loan from my bank in order to pay them. And so I ended up taking out a $20,000 loan to pay for, and I had insurance.
Wow.
Obviously it wasn't very good insurance, but this isn't an issue of just the uninsured. This is an issue for all of us.
Yeah.
And so, ended up spending the down payment that I had saved for a house, ended up in the last sort of 7,000 or 8,000. My dad and my brothers coming to my rescue and saying, we're each putting in $2,000 to get you out of this. When people don't have that, kind of money, when they don't have a bank that will give them a loan, when they don't have family members that will help them, and when you look at that alongside the fact that hospitals in our communities are making record profits, Colorado hospitals in particular, they're extracting so much wealth from our communities.
Yeah.
And so you look at all of that money, and I want to be able to say, I know where that money should be spent in my community, and I know you know some of those places, and I know the people in our community who I think could spend that money better and could really help our community to be healthier. Yeah.
But the thing I've gotten clearer and clearer about is, I'm not saying yes to something in this job or this work if it doesn't align with one of those self-interests, right? One of my self-interests. And that's not something I always was very good at.
I feel like I've been challenged a lot in this work to look at, in the time that you're spending working with Center for Health Progress, is what you're doing aimed at power building.
And your self-interest.
And is the foundation of that my self-interest.
Yes.